So hi everybody, I'm really glad to be here with, I'm Mary Zelazny, I'm the CEO of Finger Lakes Community Health, and I'm here with Dr. Tony Mendicino. He's our dental director. He and I worked together for an awfully long time, and we want to talk to you today about, our journey with telehealth and particularly teledentistry. So today we're going to talk a little bit about why we chose telehealth as a way to help provide access to care for our patients. What we think are some of the keys that we have found to a successful program implementation. And then Dr. Tony is specifically going to go into the Dalla Dentistry program itself. So just to talk a little bit about Finger Lakes, we're an FQHC community health center. We are also a migrant health center. We get some funding from HTRC to provide services to farm workers. And we originally started out as a freestanding migrant health center here in New York State. People don't think of New York as being very rural, but actually most of New York is very rural except for New York City. And some of the, Rochester, Syracuse, Buffalo, but otherwise it's pretty rural in New York State. And one of our biggest industries, of course, is agriculture, so hence the need for farm workers. And a lot of our telehealth work that we started was to try to provide access for them. So we have 8 full sites now as a full community health center. We see anybody that comes to our sites, of course. We have 8 full sites, and we go, if you look at the yellow part of the map, the circle, we're from the very top of the circle. We have our health center and several peppered in between, and then at the bottom, Steuben County, which is actually the northernmost county of Appalachia in the United States. We also have a health center down there, and we do a lot of services within those different areas, providing services, different mobile services and jails, etc. We serve about 28,000 patients last year. As you can see, a big chunk of our patients want to be seen in a language other than English, which is another reason why we really like technology, because it affords us the ability to provide interpretation services across all of our sites. We can share our staff. We have about 265 full-time staff members, and over half of them are bilingual, bicultural, because our patient base has so many folks that don't speak English. We use them for interpretation as well, so it's pretty handy using that technology. As I said, we serve anybody that comes into our centers. It's as any FQHC or known as a community health center in the country. Our mission is to see people regardless of their ability to pay, and so we do that. We have about 45% of our patients are Medicaid. About 32% is uninsured, and then 10% Medicare, and then some commercial insurance. So we see a very wide variety of folks up here in New York State. We have a lot, besides the agricultural community in terms of the farm workers, we have a lot of Mennonites, a lot of Amish. Unfortunately, we have quite a share of homeless, etc., and rural poor. So, we are a rural health center. Most of our health centers are smaller, and, we have a lot of reasons why we needed to figure out how to provide more access to care for our patients. Of course, language differences, cultural issues, the cost of healthcare, trying to get our patients up to the 2 big urban centers, which are north of most of our health centers. They're about 45 minutes to an hour and a half away from our different sites. So in order to get our patients, if we would refer them to a specialist or whatever, we had a real challenge trying to get those patients into care because they couldn't get there. There was a fear of going into the urban centers, the inability to go because maybe they didn't even have gas for their car, stigma, all kinds of issues. And of course, transportation is a huge barrier for so many of us, particularly in rural communities. So why did we pick telehealth to try to mitigate some of those challenges? Well, as far as we're concerned, we have learned that telehealth is the best tool in our toolkit because it affords us so many different opportunities to provide access. And, it crosses all those geographical barriers. We are able to expand our workforce in that we can use we have one nutritional counselor on our staff who happens to be bilingual. We're very fortunate. She spent quite a bit of time in Central America. And she can see patients across all of our sites because they can't necessarily get to her. So we get her to them using technology. A big piece for us is, of course, the reduction of stigma. That's really important for behavioral health, but I would add that's important for a lot of different things. People don't want others to know why they're coming in for healthcare. And if you send someone to a particular place for something and they don't want other people to know that they have that going on with them, using technology to reach out to those specialists really has helped us immensely. For our providers, on the provider side, what's so important for us is that and I think Dr. Tony will be able to address this, the ability to have our primary care providers have develop relationships with specialists that they reach out to, whereas we used to be able to just send a letter and say, dear Dr. Smith, thank you for seeing, my patient. These are the issues that they have. Now it's a face-to-face conversation, virtually, but it's a face-to-face conversation, and our providers, dental providers, medical providers, behavioral health providers, they can be in the room with the patient and have the specialist come in on video and really learn from the specialist. And that opportunity is huge. It's really upped our game in terms of our providers not having to refer so many patients outside of our system. So now what happens is we tend to refer the more complicated patients out, whereas in the past we had to refer everybody out because our providers just didn't feel that they had the skill set to do some of those more challenging things. So it's been really great. And I know that workforce for everybody in healthcare is a huge problem. So it has offered those educational opportunities for our providers. And of course, I'm not sure where y'all are at in Kansas and Oklahoma, out that way, but we are knee deep in trying to figure out how we're going to, as a healthcare program, adjust to this value-based care and the value-based contracting, etc. And so telehealth has been really helpful for us in terms of that whole sea change, because it's going to be big for all of us ultimately. And then for community health centers, FQHCs, this is a huge sustainability help for us. It really has given us the ability to share. We actually contract with other FQHCs down in New York City that have more psychiatrists than all of us to put together. And so we've reached out to them and tapped into some of their providers. And technology allows us to do that. So it's a really great tool. So I love this quote, and I talk to a lot of my partner healthcare providers about this, that it's just really telemedicine, telehealth is going to change our world. And I think that we all have to really, it's not a question of if we adopt telehealth technologies, it's a question of when, because it's a sustainability issue anymore. It's not if we want to. So, and that brings up the conversation, of course, of millennials. And I have a daughter that's a millennial, and I use her as a sounding board a lot because they have such a different perspective on everything. And as they say, the millennials they're the biggest generation coming up, and they want their healthcare like they want their banking. And it is not the way that we're all used to providing a lot of those services. And so the beauty of adopting telehealth technologies, besides access to care and helping our workforce, all those things, it's going to help us adapt to how our patients want to receive care. It's just a really critical item that we all have to really understand and embrace. And even to the point of how do we set up our health centers? How do we set up our primary care offices, our dental offices? Because if you can do some of this care using technology, it may not need so much bricks and mortar. I mean, it's a whole sea change for all of us. So for us, what we've learned in terms of telehealth is that, you really need to, you can't just start a whole new way of doing business when you adopt telehealth technologies. We found in our system, that we had to weave it in with our current way of providing health care, both with our dental and our medical providers. We couldn't just change everything and say, okay, everybody, we're going to do it all differently now. We had to figure out how to integrate all that, the telehealth work and the, the equipment and the processes that you need to do, and all that, as we would with any other piece of equipment, if you will. It is different though, because you may have the patient at your site, the originating site, and the specialist that's going to see your patient, maybe the dentist, the specialist, is at the distance site. The people that are at the originating site with the patient end up getting a lot more, they have a lot more work that they have to do, because they're now serving as the office for the specialist. But other than that, it should just be woven right into your system. The great thing about telehealth for us is that, and I'm sure Dr. Tony will touch on this, is how great our collaborations are now with other partners and other healthcare providers, other organizations. It has just opened our world to so many new organizations that we can actually refer our patients to and learn from other people. It's been really great for us as an organization. And we found that, with our data, what we do with all of our programs is we do a registry, and we figure out baseline data. We've done this, and we'll talk about this with our Teledentistry program. We create a registry of those patients that we've referred to that particular program, so that we can track any successes, failures, where do we have to focus more work on. So what we have found, and we use telehealth for a host of different programs, including Teledentistry. You do a lot of psychiatry, telepsychiatry for adult and children, mental health, retinopathy screenings, nutrition, pediatric neurology, HIV care, Hep C. We do primary care between sites with our providers. We're doing now medication adherence for the opioid problems. So we use it for pretty much anything we can. And we've found that it's really helped our providers develop their skill sets. It's helped our patients get into services, and our statistics show that our patients do much better when they are able to have technology reach out to those specialists, because they're actually getting to the care that they need. And of course, we have combined, what really important for us, we have combined care management with our use of technology, and we feel that that's really our sweet spot, because care management really ties all those pieces together. So for our patients here at Finger Lakes, we've reduced costs of transportation, not only for the patients, but for my staff, because we used to drive people all over the place. And now we don't have to. We can use technology to bridge those geographical spaces. There's a decrease in lost time, unpaid time for work. Really important for all of us is the reduction in emergency room visits, because if we're really going to address the cost curve in healthcare, that's really important that we focus on that. The ability to get people into treatment is quicker. But as we talk about our teledentistry program, that's been a huge success for us. And Dr. Tony will talk about that as he delves into the program. And we've been able to, give better care, more access to care, more access to behavioral health services, which is really important, because so many of our patients have multiple chronic diseases. And that's really helped us to be able to address some of those issues, because we don't always have all the resources we need on site, but someone around us has them. So we just reach out to them and create partnerships to try to provide that access for our patients. Our patients love it. We do patient satisfaction surveys for all of our visits. We do provider surveys and try to figure out, on the provider end, what do you like, what don't you like? So it's been really helpful for us, but we've had really high marks consistently. You guys probably are pretty aware of a lot of stuff. I'm just going to breeze through it because I really want Tony to talk about the dentistry. But, things that you have to keep in mind, and these are the things that we had to address: broadband, equipment, program development, the legal regulatory issues. what do we have to pay attention to as we go through our journey in telehealth. You know, make sure that you're doing your organizational assessments. We planned again, and when we thought we had it all planned, then we started planning it more, because we learned our very first experience with a telehealth visit with behavioral health. We had done our homework, thank God, but our first patient became suicidal, and we knew exactly what to do, and the staff handled it. And it could have been a real crisis, but we were able to avert it because we really spent the time planning our program. Because when you're using technology, you know, things can happen. And know why you're doing it. You know, is everybody on board? You know, make sure that you understand your own legal issues, your regulatory issues, billing, all that. You really need to understand all that. So I'm going to just keep going through here and let Tony, I really want him to be able to talk to you about the Dalla Dentistry, because it's been one of those things that it was really eye-opening for us how good our outcomes were. And the reason that we really tried to use Teledentistry was because Dr. Tony would be going out we have a big school-based program, dental program, and he would go out and see patients, kids, and he kept coming back very frustrated. And he said, you know, I referred this kid up to the city to get there to see the pediatric dentist, and, you know, I just couldn't, how come you know, I came back and here he is again 6 months later and he still hasn't gotten there, what's going on? And so that's why we built this Teledentistry program. We reached out up to Rochester, and so Tony, I'll let you talk about all this, and I will advance the slides for you. So just let me know when you want me to advance.
Okay, can you guys hear me?
Yep.
Okay, good. So, you know, we use our telehealth equipment in the dental department for multiple things. And you can see here, we do screenings, we do exams, we do urgent care, we do specialty care consults, we do post-operative and pre-operative care, as well as follow-up. We do distance learning. But the biggest thing that we are utilizing our equipment for and had the best results is our Teledentistry program. So if you can advance for me, Mary. Okay, so this was the problem, as Mary said. We'd have a child come in. We have a fair amount of rampant decay in our rural areas. We have a child under 5 come in. Now, we don't have any pediatric dentists in our practice. We don't use any kind of sedation. So we were lucky enough to have a primary care center up in Rochester, Eastman Institute of Oral Health. So when someone would come in and need work that we couldn't do, we would, again, give that parent or guardian a referral and say, give Eastman a call, you know, they'll get you in. 6 months later, that child would come in for their recare, and they'd be in worse shape. And we'd say, what happened? Well, we couldn't get through on the phone line. It was too far to travel. We went for the first visit, but all they did was another exam. We already had an exam. I had to take time off from work. There are multiple reasons why things weren't getting done. Unfortunately, we found we had about a 15% completion rate, and that's not a real good outcome. And we weren't real proud of that, but we really were struggling on how to get these folks the treatment that they needed. When we knew there was an area and a center that was close enough within 45 minutes to an hour that they could be getting treatment. So we had luckily we had a medical staff provider that had done some research for telemedicine, and in her conversations with the medical folks, found out that Eastman was doing a pilot program with the local YMCA in Rochester, New York, and they were doing a store and forward, where the staff at this YMCA were using an intraoral camera, taking pictures of children's teeth and sending them out, storing them, and then sending them to the pediatric dentist at Eastman. And they were doing a project. They were seeing how much decay and what they could do to help. So we figured, hey, let's go see what they have. We have equipment. Maybe we can do some sort of a similar program. Next slide, Mayor. So that was the start of what has become a wonderful collaboration with the Eastman Institute of Oral Health and Finger Lakes Community Health. This started about 2008, and again, we had more advanced equipment than Eastman had, and we said, hey, store and forward is okay, but what if we could do real-time exams from our sites and send them over to Eastman, so that the pediatric dentist at Eastman could actually have a monitor in his room, and he can talk to the parents, he can see how the child is reacting in the chair, and boy, we could really, really move this forward and make it into a program that's not only sustainable, but also successful and have good outcomes. So you can go next, Mayor. So what happens at that teledental consult? So again, we have a monitor in our room with an intraoral camera, and the pediatric dentist in Rochester gives us 4 or 5 different times during the month that we can bring our patients in. And again, he does things like we compile their medical history. He watches how the child reacts in the chair. He observes how they react to surroundings. He talks to the parents, make sure that the child doesn't have any medical history issues or if they were full term. And he determines at that visit what needs to be done moving forward. So their first visit to Rochester, again, which might be 45 minutes or an hour away, they're getting treatment. Not only are they getting treatment, but the dentist that child saw on the screen is going to be the dentist that's treating them. So that also makes it much less of a stressful visit. Next. So again, there's multiple ways of treatment that these children are being seen at Eastman. They can be given nitrous, they can be given office-based sedation, or they can go general anesthetic in EOR. And what's really interesting is we did check the data. The pediatric dentist in Rochester is about almost 90% correct on which type of treatment he suggested at that initial exam. In other words, if he thought maybe nitrous would work, and the patient goes in and doesn't react, then we have to reschedule and bring them into the OR. So again, at that initial visit, he was almost 90% correct, and they did have treatment at that visit.